guys, welcome to Calm Belly TV. I'm Julie O'Hara and I am the founder of CalmBellyKitchen.com. I'm an IBS health coach who helps women manage IBS with the Fodmap diet. Whew, that's the spiel. Okay, so Calm Belly TV is my weekly live show where I cover a Fodmap topic and then take your questions. And you can ask any questions. It doesn't have to be just about this topic. So we're back from about 6 weeks or so of summer break, so forgive me if I'm a little camera rusty. We'll see how this goes. And if you're joining me live, feel free to say hi. Let me know if you can see me and hear me okay. Everything looks good so far. Just checking all my little screens. Everything looks good. Okay, so let me tell you what we're going to talk about today. Today's topic is slightly technical, but it's really interesting, and it's something that it doesn't get covered very often. In fact, I've never seen these things compared in this way. So what we're going to talk about is the difference between IBS, post-infectious IBS, and Sibo. So a lot of this overlaps, and a lot of this can be a little confusing unless you really just break it down. And of course, it's important to know exactly what you have so you can deal with it in the appropriate way. All right, so I'm going to dive right into it. So IBS, you're probably all familiar with that, and most of you probably have what I consider classic IBS. That's definitely what I have. So I've never had Sibo. It's not post-infectious IBS. So classic IBS is where you have a certain set of symptoms, and the way it's diagnosed is kind of a frustrating thing because it's often process of elimination. So a doctor will look at your symptoms, and if you have enough of the typical IBS symptoms, then it's probably IBS. So that list of symptoms is known as the Rome criteria. If you've heard that term before, that's all it is that set of typical IBS symptoms. And you don't have to have all of them, but if you have enough and it, looks like a duck and walks like a duck, it probably is a duck kind of thing. But the other part of diagnosing IBS is ruling out other conditions that can have similar symptoms. So some examples of that would be colon cancer, a more serious one. Celiac is another one, or inflammatory bowel disease. So all of those can look similar, so a doctor would likely do tests to rule any of those out. So once you kind of eliminate all of that and it looks like IBS, you generally get that IBS diagnosis. So some fun facts about IBS, and one of these I didn't even know. So it's estimated that 10 to 15% of the population has IBS, and most of those are thought to be women. So the numbers say that 2 out of 3 IBS cases are females. It's also sometimes estimated that it's underreported in men, which may be true, but it's underreported, so it's hard to say. The interesting fact that I just learned recently is that IBS is the second leading cause of missed work days after the common cold. And when you think about it, I actually don't know where that number came from. I'll give you the reference to the site where I found some of these stats, but yeah, I didn't see the study. I'm not sure how they figured that out, but if you have IBS, it kind of makes sense, right? Okay. So that's IBS, and because we are going through a lot of facts and technical stuff, I do have my notes that I am going to refer to so I don't miss anything for you. All right, and the other thing to consider with IBS is that children can have it, but it can come on throughout your life. So me personally, mine started in my early 20s. It generally starts before age 50, but that's just a generalization. But adulthood is probably the most common time when it's going to begin for most people. So that's IBS. And even though I just gave you a description of it, as you probably know, especially if you're in Facebook groups and hear other people talk and ask questions, IBS is unique for everyone. So you're going to have a unique set of symptoms. That's why we have IBS D and C. Diarrhea, constipation are your predominant symptoms. So it looks different symptom-wise. The severity can be very different across different people. So, and then of course it's the triggers that really give you your symptoms. So when you start to get into the Fodmap diet, everyone's going to have a different set of triggers and different tolerance levels to those. So even though IBS is this one thing, it can look very different in different people. All right, you guys still with me? Okay, now it gets a little bit interesting. So I want to move on to post-infectious IBS, and that is exactly what it sounds like. It's IBS that comes on fairly suddenly after a infection of the stomach and intestines. So the infection is usually a bacterial infection as opposed to a virus. So an example would be salmonella, right? So you would get a bacterial infection from eating contaminated food or water. That's typically how that would work. So that type of an infection. Now, everyone who has a bacterial infection will not get IBS. It's the unlucky few who do. But what predicts it is usually the length and the severity of the infection that you have. So if it's very prolonged and very severe, there's a greater chance of getting that post-infectious IBS. Okay, there is actually some good news, though, if you're one of those people who does have it in relation to an infection. So there's a very good chance that you will recover completely from the post-infectious IBS, but it could take a number of years. So the one stat that I saw, and this is of course just an estimate, is that around 50% of people with post-infectious IBS do recover, but it can just take a lot of time. So with that type of IBS, the Fodmap diet is a great management tool, just like it is for classic IBS, just to manage your symptoms, just to improve your quality of life and make eating and dealing with your symptoms easier. So that's post-infectious IBS. I'd be curious to know if anyone knows they're experiencing that. And if you have it, there's a good chance you would know it because you would have had a fairly severe bacterial infection, shortly before the IBS started. So if you do have that, maybe share your experience in the group, in the Calm Belly Kitchen Crew Facebook group, just to kind of start a conversation and kind of, it's nice to learn from other people's experiences, and you can see sort of parts of yourself and get insights from it. So that's one of the best things about the group, in my opinion. All right, so you still with me? I see Brooke, I see Christine, I see Andrea. Thank you for the thumbs up, guys. Now we're going to get into maybe the most interesting and also the most frustrating part of this topic. So SIBO, right? So SIBO is, if you think IBS has a lot of gray areas, we don't know the exact cause of IBS. That's still not completely understood. There are theories, but it's not understood. SIBO is an even bigger gray area. And the reason for that is because it looks a lot like IBS in terms of symptoms. So let's see here. What's my next point about SIBO? It looks a lot like IBS, except the typical IBS treatments don't always work. So one indication that you might have SIBO is that you do the low Fodmap diet, you get really good at eliminating Fodmaps, and you just don't see a lot of big improvements. That doesn't necessarily mean you have SIBO. There could be other things going on, but it indicates that it's one possibility. So the other thing about SIBO is that it's extremely hard to treat. Okay, so unlike classic IBS, you can potentially recover from SIBO, but it's very hard to treat. One other issue is that diagnosing it is very hard. People can go years and years before they finally get that diagnosis and get started on the treatment. So the one way that doctors diagnose it is through a breath test. So it's a fairly simple, non-invasive test, but the problem is that it can give false positives and false negatives. So it's not necessarily accurate. So a lot of times, if you're working with a doctor, you might do the SIBO treatment without having the test, if the doctor thinks it's not reliable, which is a valid opinion. So you might just go for the treatment without knowing for sure. And the treatment for SIBO is antibiotics. So let me stop and take a breath here. I know I'm throwing a ton of information at you. So SIBO is different from IBS. It's a bacterial overgrowth in your small intestine. I'm definitely going to backpedal here. I should have been on my notes more. I'm just like data. Okay. So that's what SIBO stands for, small intestine small intestinal bacterial overgrowth. So what happens is in that small intestine, you've got too much of the bad bacteria and it's causing those symptoms. So possible reasons for this, and your SIBO might be caused by something different than someone else's, but I'm going to give you some of the possible reasons. This isn't an inclusive list, but these are a lot of the common ones. So very slow gut motility. So that means food is moving through your system slower than normal. And because it's so slow, because it's spending so much time hanging out in the small intestine, the bacteria can grow because it's in there for so long. Another cause could be structural abnormality of the digestive tract. So especially in women, we have these digestive tracts that are just like this, and if it's really, the structure is causing slowness, it's kind of tied to the motility issue, bacteria can grow again. Other causes. So another cause, you might have a condition that causes damage to the nerves and muscles in your gut. So just two examples of that would be diabetes mellitus and scleroderma. So there are certain conditions that, as we start to learn, everything is connected and it can damage those stomach muscles, again, affecting motility. So a few more. If you've had surgery in the digestive tract, anywhere in that area, scarring from surgery or as a result of Crohn's disease, it can lead to issues with that digestion around the small intestine and cause the bacterial overgrowth again. And finally, low stomach acid production. So there might be a lot of reasons for this. If you're taking acid blocking medications, that could be one. Just the natural aging process can reduce your gastric acids. As well as infections, for example, H. pylori. That's another bacterial infection that affects those gastric acids. And the acids help you digest the food, as part of the process. And if you're not fully digesting it, it can ferment and feed bacteria. So those are all possible SIBO causes, and yours may be different than someone else's. So back to diagnosing it, right? There's a breath test. It isn't always accurate. So if you get to the point, if you're working with a doctor, and you definitely, need a doctor's advice for this because it is a complicated road and diagnosing it is difficult, then you would do a treatment, a course of antibiotics. So the most popular one, the most successful one right now is rifaximin. But there's an alternative to that, and a lot of people that I know who have gone through SIBO treatment have told me how expensive that is, and apparently no one's insurance covers it. It is very expensive. The alternative is taking botanical microbials. So that's basically a natural botanical antibiotic. And studies have shown that it is as effective, possibly more effective than the I cannot think of the word I want, than the antibiotic, than the rifaximin. So those are two treatment options, and it's, I am not a medical expert. I'm not telling you what to do. I'm trying to give you kind of an overview so you have the talking points and the right questions and the right things to start exploring with a doctor if you think this might be you. All right, so that's the possible causes. That's the treatment for SIBO. How do you know that you might have SIBO as opposed to IBS? So like I said, the first thing, Fodmap, eating low Fodmap might not be giving you all that much improvement. So that might be one sign. But other signs are if you know you have low stomach acid, if a doctor's told you that, or if you've taken acid-blocking drugs. A vitamin B12 deficiency can be a sign of SIBO because one of the things those bad bacteria really love is vitamin B12, along with a lot of other nutrients, but that's one of their favorites, apparently. Difficulty digesting fat is another indicator of SIBO, and the presence of associated conditions. And if you start searching online, you'll see a very long list of conditions that are associated with SIBO. That does not mean they cause it. There has been no evidence that any of these conditions causes SIBO, but they happen to be related. So more often, one of these is present in a SIBO sufferer. So just a few examples of those are Crohn's disease, diabetes, IBS, scleroderma, celiac, and even rosacea. So it's kind of a diverse list, but again, none of these things has been proven to actually cause it. They are just associated with it. All right, so that's your SIBO rundown. And if you're listening to this and you have a ton of questions, I completely understand. I will do my best to answer. If you're watching the replay, leave a question in the comments, but please tag me. So put my name so it, Facebook finds me and tags me just to make sure I don't miss it. I try to come back and check, but it's easy to miss them on the videos because they're not always in order. So, for the live viewers, and thank you so much for sticking with me and watching. I really, really appreciate it, and I love when you come live. Do you have any questions? Let me see if I've got anything yet. You can ask anything about this presentation or anything Fodmap in general. I always leave room for Q&A, and I am here to help you. All right? Let's see. Let's wait. I'll wait just a sec. Christine says, I have IBS in addition to UC swell. All right. Maybe I'm just trying to think and talk right now, but I cannot think what that is. I'm sorry. I'm sorry. I'm not sure. I'm sorry, Christine. It is really hard when you have another related condition with IBS. Sometimes that can complicate the IBS even further, and sometimes it can make other treatments not work as well. So if you have something else going on, let's see, another example would be maybe you've had stomach ulcers, and so that can get in the way of IBS. The Fodmap diet may not work as well in certain cases like that. So it is hard when you have those related conditions. Ulcerative colitis. Yep. Thank you. Yeah, and that's common. A lot of people have both of those things. I've definitely had a few clients that have that. Okay, Linda asks, are SIBO symptoms the same as IBS symptoms? They are really similar. I think I went over some of that. I did talk a lot. Maybe I can't remember everything I said. They're very similar, and that's why, it's so problematic and so hard to tell if it's SIBO or IBS. One thing that might be an indicator, and this, I've really just seen this in experience working with clients, with SIBO, you frequently get bloated really quickly after you eat. So with just classic IBS, all those symptoms, all the kind of bad things start to happen in the large intestine. So your food goes through the small intestine first, then down into the large intestine. That's where the FODMAPs ferment and cause gas and pull excess water into the bowel and cause those, diarrhea, constipation symptoms. But with SIBO, things are happening up in the small intestine because that's where that bacterial overgrowth is. So you might experience that bloating and discomfort really quickly after eating, whereas with IBS, it usually happens at least 2, 3, 4 hours later. But otherwise, it is really hard to distinguish the difference with symptoms. If the low FODMAP diet is working, does that mean SIBO is not a concern? Likely yes, Sarah. That's a really good question. So if it's working, then, good. Don't question it. And of course, you want it to consistently work. So, if it's been working for 2 weeks, I would say, keep going. Over 8 weeks, you usually do the elimination part for 6 to 8 weeks. If you're seeing it working for that much time, then you probably don't have to worry about SIBO. I've worked with, I don't even know how many women now in my group and my one-on-one. The FODMAP diet works. It may not make you feel perfect, but it will improve your symptoms a lot. And if that's happening, then SIBO shouldn't be an issue. It's when you just can't get rid of that bloating, those problems, no matter what you eat, then you start looking at SIBO and maybe some other things. Did I miss anybody's question? I don't think so. Thank you for the awesome questions, you guys. I love it. And yeah, I didn't want to have this topic to worry people that, oh no, I have SIBO, but it is really important to know what you're dealing with, right? And when it can be so many different things, and Sibo is just one possibility, but it's the one that can be really tough to get accurate information about and learn about and diagnose. I should also mention the dietary treatment for Sibo is actually a little bit different, and that's why it does really help to know what you're dealing with. So in addition to doing antibiotics to get rid of that bad bacteria, for at least a few weeks, for 2 to 4 weeks, you want to eliminate sugar and carbs almost completely. So that's the way I do it with clients who have Sibo. You eliminate all of that stuff. And it's hard, but it's just for a short amount of time because you don't want to feed any of that bacteria and have the Sibo come back. And that's why it's so hard to treat, because it often does come back. So you cut out sugar, and then you go into a combination of the specific carbohydrate diet and the low Fodmap diet. So we kind of go to specific carbohydrate, which is, I'll put a link down below this video where you can learn more about Sibo and about the SCD diet. It's a long story, but it's another sort of restrictive diet designed to get those fermentable carbs out of your diet. And then we go on to a low Fodmap diet, which seems like a breeze after all of that. But that's the way that you prevent the bad bacteria from coming back and really get rid of that Sibo. Would probiotics help with Sibo? There's mixed research on that, and theoretically, yes. You know, you're putting good bacteria into your system. I believe, and again, I'm not a medical expert, but some doctors would recommend doing the probiotic either with the antibiotic or right after. So it kind of depends on that. But yes, they likely would help. Awesome questions, guys. All right. If you do not have anything else for me, which if you're putting it in right now, go right ahead. I'll hang out for just a few more seconds. But thank you so much for joining me, and I'll be here next week with maybe a more fun, less technical topic. It'll be nice for me and nice for you. But until then, if you have more questions, you can leave them on the video and tag me. Or if you have general questions, put them in the Facebook group, and you will get answers from all the other brilliant women in there right away. But I think that's all for now, all right? So thanks so much for tuning in. Oh, and what about a prebiotic? Oh, okay. So a prebiotic the difference is that is actually the food for the good bacteria. However, with Sibo, that bad bacteria, that overgrowth, would feed on your prebiotic. So no, you wouldn't do a prebiotic. So a lot of high Fodmap foods, a lot of high carb foods are full of prebiotic fiber, and that's what you don't want to be eating if you're treating Sibo. So that was a pretty short answer. That's good. All right, guys, I will talk to you next week. Have a fabulous night. Bye.